When we think about burnout in healthcare, we often think of doctors and nurses. But what about sonographers? These professionals play a vital role in diagnosing medical conditions, yet their burnout is often overlooked. Today, I will be discussing how burnout affects sonographers, their performance, and patient care, and why this is a systemic issue that needs urgent attention. So, what is burnout? Burnout is a state of emotional exhaustion, depersonalization, and reduced personal accomplishment. It happens when professionals are overworked and undersupported. While burnout is common in many healthcare roles, it's particularly concerning for sonographers due to the high stress nature of their job. Sonographers often work long hours performing complex imaging exams, often with patients in pain or in discomfort. They're expected to be precise, efficient, and compassionate, all while managing heavy workloads. Their job is also physically demanding. For example, repetitive motions like holding ultrasound probes for long periods of time can lead to injury. A study found that 87% to 100% of sonographers reported experiencing burnout. This means nearly all of sonographers are affected in some type of way. So, how does burnout affect patients? When sonographers are exhausted, their ability to engage with patients declines. Burnout can make their work feel routine, leading to less attentiveness and more errors. Since ultrasound imaging is crucial for diagnosis, a lack of focus can result in a misdiagnosis or delayed treatment for patients. Additionally, lower patient satisfaction is a major concern. If a sonographer is too exhausted to offer reassurance or proper communication, the patient's experience suffers. Burnout doesn't just impact patient care. It also affects the well-being of sonographers themselves. Physically, many suffer from wrist, shoulder, and neck pain due to repetitive motions. Mentally, the constant pressure leads to stress, anxiety, and job dissatisfaction. In fact, a study showed that many sonographers wouldn't recommend their careers to others. This is alarming because it threatens the future workforce in sonography. So, what is causing this burnout? It's not just the nature of the job, it's the way that the system is structured. For example, sonographers work an average of 38.6 hours per week with an additional 7.3 hours of on-call. They also get very few breaks, only about 34 minutes per day. Without time to rest and recover, exhaustion builds up, impacting both job performance and personal well-being. So looking at this table, we've already talked about the first two data points, and I really want to highlight the last two. So about 52.6% of sonographers experience interrupted workflow, and 55.2% of sonographers experience work pressure and performance. So this shows that sonographers are in high-stress situations, which can lead to burnout. A common myth is that burnout is a personal issue, that it's just about resilience and attitude, but research proves otherwise. Workplace factors like understaffing, excessive workloads, and a lack of support play a much bigger role. If these aren't addressed, burnout will continue to rise. So what can we do about it? The first step is recognizing that sonographers are essential healthcare workers. Their well-being directly affects patient outcomes. Hospitals and clinics need to prioritize better staffing, realistic workloads, and mental health resources to prevent burnout. Addressing these issues isn't just about helping sonographers, it's about ensuring better patient care and a stronger healthcare system. Burnout among sonographers isn't just a personal struggle, it's a systemic problem that affects job performance, patient care, and healthcare quality. If we truly care about improving healthcare, we must take burnout seriously and push for a meaningful change. And this concludes my PowerPoint. And I would like to thank everybody for their time and for watching this PowerPoint. Have a great day.